This is the cognitive model. So this is a very, very simplified version of it. Basically, we say kind of a situation takes place, and we have cognitions or thoughts or interpretations of what just took place. We attach some sort of meaning to it. And then from there, we experience emotions around it. And then from there, we engage in certain behaviors, okay? So an example is coming here this morning. My interpretations might be, I'm just not prepared enough. And so my feelings might be anxiety, like I said, and my behaviors, what were my behaviors? A lot of the ums maybe in the beginning, or maybe still talking with my hands a lot, shifting a lot, right? So these might be my behaviors, and I'll try to make them stop. But if somebody else walked in and said, you know what, I'm totally prepared, I've done this talk a million times, this is gonna be great, I'm excited to meet everybody, which I was, and this is gonna be awesome, I can't wait to do this. My feelings are gonna be different than anxiety, right? Or there might be a little bit of anxiety, but that's not gonna be the primary emotion. So primary emotion would be excited, thrilled, happy, and my behaviors might be, hi everyone, right? And really put on a show, and do a lot of mingling and all sorts of other things. So you can see how this model, just this model right here in this example, how somebody could have a lot of social anxiety, for instance, right? So if this is the model, the CBT therapist aims to change cognitive patterns, so that you can behave differently. And when we behave differently, we end up feeling differently, okay? Think about the example of somebody who is depressed, okay? So with depression, and I'm gonna talk about this, the first and foremost skill and intervention that we utilize is behavioral activation. How many of you guys are familiar with behavioral activation? This is the first thing we do, is kind of the gold standard first line of treatment as far as CBT is concerned for depression, because they come in and they're so inactive. They are not active at all. And what do we know? There's a vicious cycle. We get depressed, we can't get out of bed because we're so depressed, but the more we stay in bed, do we feel better? Absolutely not. We end up feeling much, much worse. And then we end up feeling worse, and then we have thoughts like, I'm never gonna get better. This is useless, this is hopeless, I shouldn't even try. And the more we say that to ourselves, we end up feeling worse. The worse we feel, we end up staying in bed more. We end up not showering anymore, not brushing our teeth, and then we end up feeling, bad about ourselves. I'm this, I'm that, I can't even get it together to brush my teeth. What am I turning into? So very transactional, right? Okay, so that's the CBT model. We aim to change cognitive patterns and behaviors ultimately to improve mood.